Support comes from the Missouri Forest Products Association, committed to conservation and careful management of the state's forests to make them more resilient and better habitats for wildlife. ChooseWood.com.
This is St. Louis on the Air from St. Louis Public Radio. I'm Elaine Cha. At least a few times this summer, we've woken up to hazy skies clouded by wildfire smoke from way up north. And if you're like me, you've been checking airnow.gov more often, not just for myself, but even more so for my 70-year-old mother-in-law and my 7-year-old outdoor summer camper. Now, some days, the air quality index is so poor that we're advised to stay indoors. But even on seemingly clear days, the St. Louis region often has poor air quality, and it has nothing to do with wildfires. So what is it about St. Louis as a region that leaves our air quality so much to be desired? And those weather app alerts that tell us to avoid being outside, how much credence should we give them? And really, how bad is St. Louis's air and why? Joining me in studio to talk about it is Jack Fishman, professor of meteorology and director of the Center for Environmental Sciences at St. Louis University. Jack, welcome to the program.
Thank you.
Now, how would you rate St. Louis's air quality compared to other similarly sized cities in the U.S.?
Well, I really don't think St. Louis is that much worse off than other areas in particular. And I think if you look in a historical perspective, air is much, much cleaner almost everywhere because of the passage of the Clean Air Act in 1970. So I sort of take a little bit of issue saying that St. Louis is specifically worse off than many other places. The real problem is that the entire planet is sort of getting dirtier. So we're seeing background concentrations of pollution increasing. We all know about carbon dioxide, but one of the ones that I've been specializing in for almost 50 years is ozone. Ozone is an irritant, and it is the pollutant that is most often exceeded insofar as the air quality criteria standards that were set for it in the St. Louis region. But again, like I say, the bad ozone that we used to see back in the 1970s and 1980s, we don't see those kinds of concentrations anymore. But because of the growing background concentrations increasing, we could exceed the standards more frequently just by adding a little bit of what St. Louis emissions would contribute to it.
Mm-hmm. Now, background concentrations, what do you mean by that?
Well, I guess I got my start looking at what we call global scale cycles of atmospheric trace gases. And in particular, like I said, my specialty was ozone in the lower atmosphere. There's still a lot of confusion. Ozone is an important trace gas because when it's in the stratosphere, it protects us from ultraviolet radiation. Unfortunately, when it's down here at the lower atmosphere and you're breathing it in, it's an irritant. So this is why we have regulations to try to control the concentrations. So what we're finding, and we did an analysis that we published about 12 years ago, looking at 30 years of ozone data here in St. Louis, the background concentrations are increasing, but what we see is when it's dirty, it's not as dirty as it was. So the phrase we sort of coined here is that the dirty air is getting cleaner, but the clean air is getting dirtier. So what that means is that we don't have to add that much more locally to exceed the standards and be put in these categories, what we call orange or red anymore, where the amount of pollution in the atmosphere is hazardous to certain health groups, especially like you mentioned, your son or your daughter who is 7, and the older generation. It affects older people and young people the worst, and especially people who work outside. And then more importantly than that, you shall hear probably in a few minutes, those who are susceptible to diseases like asthma and stuff like that.
So looking at airnow.gov, there have been a few days recently where we were in the red, meaning that the air was unhealthy. Is that because of the wildfires in Canada, or is it our ozone pollution, or really just a mixture of both?
Yeah, the answer is both of the above, exactly as you say. Unprecedented wildfires in Canada, and because of the way that we had transport from Canada down to the Midwest, and then, of course, once it hit the East Coast, and you saw these amazing pictures over New York City where the sky was orange. So it's a combination of these massive fires that are taking place in Canada and the right meteorological conditions. And in addition to that, when we have the right meteorological conditions here in St. Louis, what we often refer to as the dog days of summer, we're trapping pollutants near the ground, no more so than in other areas of the country, but we feel it here in St. Louis, especially with the very high humidity that we have here in St. Louis. So we can feel the situation under which we have really polluted air.
Jack Fishman is professor of meteorology and director of the Center for Environmental Sciences at St. Louis University. We need to take a quick break. When we come back, we'll continue this conversation and focus on who's most affected by poor air quality and what can be done to address disparities in care and support. This is St. Louis on the Air on St. Louis Public Radio. Welcome back. Before the break, we were discussing the St. Louis region's air quality, whether it's unhealthy red days or orange ones that are unhealthy for sensitive groups. Anything other than green days deemed good by airnow.gov has negative effects on certain residents across the St. Louis region. Here to talk with us about that, we have Kelly Harris, Assistant Professor of Occupational Therapy and Surgery in Public Health Sciences at Washington University. Welcome.
Thank you. Glad to be here.
And Leah Clyburn, community leader and environmental justice advocate with the Missouri Sierra Club chapter. Welcome to you.
Hi, thank you.
Thank you both for being here today. Now, Kelly, who is most affected by poor air quality?
Wow. So I do asthma research, so I'm going to speak to kind of the area I work in most. And I think that youth with asthma in particular in our region are highly affected by our poor air quality days.
Mm-hmm. And Leah, back in 2021, you organized a bi-state rally for cleaner air. You brought together people from North St. Louis and East St. Louis at the McKinley Bridge to share their individual struggles with the region's poor air quality. What do we know about the air quality in East St. Louis and its effects?
Well, throughout our St. Louis region, there was actually a study shown that there is a significant difference between our, various demographics. So what you have is like white Americans experience 17% less pollution than they generate. And unfortunately, where does that pollution fall? It falls on the backs or the lungs, if you will, right, of Blacks and Hispanic population at the percentage rate of 56% more pollution for African Americans and even 63% more for Latinos. Mm-hmm. It's inequitable, and it is a constant reminder that our communities, we're all one community. Our children are, like the professor said, are the most impacted. Mm-hmm. I mean, Missouri, St. Louis alone scores, according to the St. Louis Equity Indicator report, scores as one of the worst areas in our country in regards to air pollution and asthma rates within our children. And our children deserve better. We deserve better.
Mm-hmm. Now, speaking of kids, Kelly, how is it that pediatric asthma impacts outcomes for youth?
So I think there are several ways, right? So, just to kind of touch on what Leah was saying, we see disparities in our asthma rates, right, with Black populations in particular in North St. Louis City, North St. Louis County, having some of the highest asthma rates in our region. And we know that asthma impacts youth directly through thinking about, kind of stress, lack of sleep or disrupted sleep, cognition and kind of motivation impacts. And then there's also indirect impacts on academic outcomes through attendance at school. So asthma is the number one reason that kids miss school. And that missed time in the seat, those are lost learning opportunities. So there are multiple ways. I think, if we think about individual stress for kids, but then also for families, right? So it impacts kids' outcomes, but then we have to think about caregivers and parents who have missed time at work to care for their children who are experiencing asthma symptoms or asthma flares.
Right. And those parents themselves may also have asthma that they're dealing with.
Exactly.
Multi-generational homes. You have also grandparents.
Exactly.
Right? Upper respiratory. Yeah, the story goes on and on.
Yeah. Kelly, your 2019 study about asthma in kids, it highlighted the need for investments and interventions to improve 1, environments, 2, health, and 3, economic resources for our region's youth. So that was in 2019. Has any of that been addressed?
Not directly. I think that we still have a lot of work to do. So that story was in 2019, and then in 2020 we kind of shifted focus to some other things that were happening nationally. But I think that when we think about healthcare, really investing in greater access to healthcare and to primary care, so not just emergency department and urgent care access, but really being able to access primary care providers and asthma specialists on a regular basis, access to medications. We know that if we look at just the geographic distribution of those facilities and resources in our region, they are not in the places that study actually shows that it's a geospatial analysis that they are not in the places where the highest rates are. So even when we have access to care, it's often inconvenient, right? You have to have transportation.
Yes.
Our transportation system, while good, it doesn't go everywhere. So that's a challenge.
And
go ahead.
Yeah, what are some good resources for families in our area?
So there are, the Asthma and Allergy Foundation provides resources both directly to families and through schools. So resources like, access to medication. They have partnerships with pharmacies that help provide that medication. Again, you have to be able to get to it. Then they also provide individual resources to families to just mitigate some of the triggers that are inside our homes, things like bedding covers and things of that nature. Several of our schools have resources through like a mobile asthma van program, Healthy Kids Express, which operates out of Children's Hospital and BJC. And so there are those types of resources that provide that access to some additional, medication and treatment services.
I did not grow up in the St. Louis area, and it was, quite a number of years ago. But the way that asthma is talked about now and the way that it's talked about here is nothing like what I remember growing up with. Now, Leah, you were part of a coalition that put together a report also in 2019 that highlighted environmental injustices in St. Louis, that is. And you and your co-authors wrote that St. Louis has been in violation of the federal health-based air standard for ozone since 1979. So that would be when I was growing up. And that it violated the federal-based standard for fine particle pollution from 2005 to 2017. What does health-based standard mean? And who needs to be held accountable for these violations?
When we talk about standard, we're normally, I'm not an expert on that part, right? But when you talk about standard, the baseline is nationwide, right? The expectation that we all should be held to, right? For a better quality of life for all. Kind of the whole point, right? And who's to be held accountable? This is where our regulatory agencies, like the Department of Natural Resources of Missouri, the MDNR, and our EPA, which is Environmental Protection Agency. They need to be held accountable. Our EPA, we need to call our EPA up and be like, we need you to hold our MDNR accountable for how they regulate our utility companies like Ameren and their coal plant over in Labadie. We have too many coal-fired plants in our region that do not have the scrubbers, do not have the protections to protect those who use their utilities, scrubbers that'll allow for the reduction of so much CO2s. At the end of the day, this is a nonpartisan issue. So our governor also needs to step up. He regulates. Governor Parsons regulates and holds the MDNR accountable. But if he doesn't hold them accountable just because he might not like who this is most impacting, or the region in which it's impacting most, such as St. Louis, because of the political strife. This is not a political issue. This is about people's quality of health.
Yeah.
This is about the future of our state, and we deserve better. We love to be outside. The one thing that anybody, whether you grow up in Missouri or you're from somewhere else, you learn about going to the river. But you can't go to the river if you can't breathe outside, right?
Exactly.
And, the earlier y'all were talking about parks. We can't go play basketball if you can't breathe,
Right.
And so many things, when we talk about our children, we talk about our community, we need recreation. We need to be able to commune with our environment around us. There's facts around how it helps us mentally and physically, but we can't even take on those natural resources of healing due to these lax laws, these lax agencies, these lax regulations.
And this really gets to what people experience, like on the individual level. And Kelly, I understand that your son and daughter both live with asthma. I mean, how does your family's experience with pediatric asthma in particular inform your work? And then how does it just make you sort of think about what people can do to create some change?
It really informs my work. I think that it helps me to understand, I'm interested in asthma work broadly and asthma in particular among school-age youth. And so I have 2 school-age youth who have asthma. And so thinking about understanding what that means on the ground every day is important. Thinking about, kind of the air quality issues we've had here of late. A conversation I have with my teenage son often is about whether or not he should be spending time outside and whether, he wants to go do X activity that's outdoors for however many hours. What does that mean for what your evening is going to look like and what your medication use is going to look like? I think those are things we think about. The other thing we think about a lot is, kind of that access to medications. We have great access to medication, but only so often.
Okay.
And so if we are concentrating our use early in the month and, we can't renew prescriptions for a longer time, those are things we have to be able to plan for. And I think that, so just kind of the everyday implications of what it means to have asthma or have a child and be a caregiver of a child with asthma. And then what that means for their day-to-day experiences. What does that mean to not be able to go outside? For, when I was growing up, that's what we did all day, every day, all summer, right?
Locked outside.
Yes, exactly. You stay out there for a while.
Right, street lights.
Yeah, exactly. And so thinking about, having to tell him, no, you can't go to this activity because it's outside too long and it's really just not wise for your health. And I think those are the hard decisions and the things that, are the day-to-day implications.
Right. And that goes to that family stress that you were talking about, like sort of constant low grade always there.
And that's a family with means.
Yeah.
Yeah, the flexibility, you don't get a long warning sign when asthma's going to flare to know that you need to be able to build it, have time to take off of work and those things. It kind of happens when it happens, and being able to be flexible and account for that is hard.
Yeah. Now, Leah, you'd mentioned parks. How much does green space in our region play into asthma rates and air quality? And maybe it should be not so much like what green space exists, but what doesn't. So, the existing tree canopy in North St. Louis is the lowest in the region.
Right.
And that correlates with your data on childhood asthma, Kelly. So,
gotta love the trees, right? Who knew the trees can just clean everything, right? Yeah. It's our natural filter system. And yet, why are we missing? Why? And where are we missing, right? Like you acknowledge that, you can look, if you look from, a bird's eye view, you can see the difference of where the greenery is, where the trees are and where they're not. And where they're missing is predominantly Black neighborhoods. And yet that's where the pollution is carrying, right? Because our natural filtration system is missing. We need those trees, but we need trees also in parks to be accessible to all people, whether you have the funds or not, right? We all pay taxes one way or the other. And so our tax dollars go to make sure that these parks are available for all in the area. When we talk about having that kind of access, we're talking about a better quality of life with something just so simple as a native tree in Missouri to be grown, to be nurtured, and to provide the cooling, the shelter, the calming, right? But most importantly, the cleaning that is necessary.
So it takes some time for trees to grow.
True.
So insofar as what is possible in the present, Kelly, what is it that individuals can do to protect themselves from poor air quality's harms?
On an individual level, I mean, I think thinking about our own indoor spaces and making those as healthy as possible. But I think, and accessing those resources, again, a lot of those things are not easily accessible, free or cheap, right?
Sure.
So I think there's that. I think, being mindful of, being aware of what the air quality is like and how we're, kind of moving in and out of it. I think, though, thinking about kind of the community element of our outdoor spaces, I think trees is a big element. I think debris and trash is another. And I think similarly, we see kind of geographically, we can see where things are, kind of cleaner, nicer, better, healthier in terms of environments. And so I think, we can all individually contribute to that. I think that's also, though, a kind of broader population level investment that we need to be making. But I think, on an individual level, it's really about kind of taking care of our health, really being mindful, being aware of air quality outside, and just thinking about how we're engaging in that and making sure that we're protecting ourselves, protecting our kids, advocating for our families, our children, and each other.
In your community work, Leah, have you heard about things that people in clusters or in community are doing in order to get to the things that they need?
Yeah, I mean, the community, what's best about community is community works together. The St. Louis Mutual Aid has been working together with any and all people willing and able to help provide any and all resources to people in need, and making sure that we connect those individuals with local, healthcare groups and or churches. And then there's also, I can't leave out, they over in North City, they did this. The box fan filter training, right? But that's not our responsibility. That's not the people, right? Because that's a real small print or thing that we could do when actually, what's coming up, we're about to enter an election year. It's real. We have to vote people in Jeff City that are aligned with the care for all people and not just for a few, in order to better hold our Department of Natural Resources accountable, to hold these agencies accountable, right, for better care for the earth.
And the box fan filters, can you quickly describe what that is?
Oh, yeah. So I had to learn myself, right, because I was really surprised. But people have been doing this for years because they couldn't rely on the state or the city to help them fix this problem. So what they would do is you get a box fan and you take, the filters that you would use for your heating and air conditioning, and you tape it on the box fan. You turn the box fan on, you put it in a window, and you let it run, and you seal it off around. And the hope is, just like when we wear the face masks during, the height of COVID, is that filtration system will try to collect as many of those particles that is in the air as it comes into the house.
So it's a DIY that should not be DIY.
It should not be DIY. And but it was really cool that they've people have found magical ways of like adding, and I say magical because I think it's really cool when you bring herbs into the space. So they brought in lemongrass and lavender and different things to help with even the idea of not being able to breathe impacts people's, emotional level, right? And ability to, even if your emotions aren't right, then your cognitive isn't right? And so bringing in ways to bring in calmness into the space, even in such a stressful situation.
Leah Clyburn is a community leader and environmental advocate, environmental justice advocate with the Missouri Sierra Club. And Kelly Harris is assistant professor of occupational therapy and surgery in public health sciences at Washington University. Appreciate you so much today.
Thank you.
Thank you.
This episode was produced by Emily Woodbury, with audio engineering and podcast design by Aaron Dorr.
Our executive producer is Alex Hoyer.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
St. Louis on the Air proudly supports local artists by using music from Life Creative Group.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations, and leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thank you.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.
Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.